Imagine this. Your high-yielding dairy cow has just calved, but within hours, she's wobbly, listless, and down. You're staring down the dreaded postpartum hypocalcemia. Sound familiar? In the world of dairy farming, calcium is king, especially around calving. As veterinarians and livestock professionals, we've long known that calcium plays a critical role in muscle function, nerve transmission, and milk production. But here's the twist. When you give oral calcium can be just as important as how much you give. One that doesn't just prevent clinical milk fever, but unlocks the full potential of your cow's postpartum productivity. Let's explore where science meets strategy in calcium supplementation. During the early postpartum period, dairy cows experience a sudden and dramatic demand for calcium due to colostrum and milk production. While intravenous calcium works wonders in acute clinical cases, oral calcium supplementation has become the go-to method for preventing subclinical hypocalcemia, especially in multiparous cows. But not all calcium protocols are created equal. Traditionally, producers were taught to administer oral calcium boluses immediately after calving and again 12 to 24 hours later. However, a fresh wave of research is challenging this practice and redefining what really works. A University of Wisconsin study discovered that administering oral calcium on day 2 and day 3 postpartum, rather than immediately after calving, produced greater milk yields in weeks 5 and 10 of lactation. Surprisingly, there were no significant changes in blood calcium, suggesting the calcium was directly utilized in supporting increased milk production rather than floating in the bloodstream. This sweet spot offers a practical takeaway. Delayed calcium dosing may fuel lactation better than immediate supplementation. Not all cows are created equal when it comes to calcium needs. Research shows that third lactation and older cows are more prone to subclinical hypocalcemia due to their increased milk production and lower calcium reserves. These cows, often the most productive in the herd, benefit significantly from oral calcium supplementation on days 2 and 3, as opposed to earlier or blanket treatments. By identifying these high-risk cows, farmers can target resources efficiently and boost herd productivity. A typical oral calcium bolus, e.g. 43 grams of calcium from calcium chloride and calcium sulfate, is effective if the cow is standing and alert. The bolus is administered properly using a balling gun, and a high-quality product is used, preferably with a true gel base to prevent dribbling and ensure proper ingestion. Important: never give oral calcium to a down cow. It may cause aspiration. These animals require IV calcium under veterinary supervision. Aside from milk production, effective calcium management reduces the risk of retained placenta, uterine prolapse, metritis, mastitis, and ketosis. In short, getting calcium right means healthier cows, less vet intervention, and better profits. Calcium supplementation isn't just a checkbox. It's a science-backed strategy. And now, we know that the true sweet spot may come a little later than we thought. So the next time you're preparing for a fresh calving, remember, don't just reach for calcium. Time it right. Prioritize older cows and target your interventions. Choose quality products and use best practices for administration. By embracing these modern approaches, you're not only preventing disease, you're optimizing your herd's potential.